Hello, doctor. Thank you for taking time to speak to me today on this virtual call. My name is Nancy Kasprzak, and I represent Nestle Health Science. Just wanted to verify a couple things before we get started. First, can you hear me clearly on the audio?
Yes,
Great. And can you see the first slide that I have up for presentation?
I can.
Okay. I also wanted to share with you that you can feel free to mute or unmute yourself at any time to ask a question. And if for some reason we get disconnected, just feel free to reconnect using the same link that I sent you earlier. So during the call, we'll be reviewing modulin and the disease states, the Levine study, the Crohn's disease exclusion diet, also known as CDED, phases of the diet, how to become the expert, and resources that are going to be available to you and your staff. So I'm going to switch slides here, Doctor. Doctor, as you're aware, Crohn's disease has no cure. However, as of May 1st, there's now modulin, a nutritionally complete powdered formula for the dietary use of patients with Crohn's disease who choose to follow an enteral diet as either a sole or partial source of nutrition under medical supervision, such as with you. Modulin meets criteria for partial enteral nutrition, also known as PEN, as part of CDED, which we will discuss further. It is gluten-free, suitable for lactose intolerance, halal, and free from artificial sweeteners, flavors, and colors. Modulin provides flexible caloric density and complete nutrition for children ages 5 and older, as well as adults. Nutrition guidelines recommends EEN as a first-line treatment as it is proven to be effective, safe, and tolerable for pediatric patients like yours with Crohn's disease. So I'm going to move to the next slide. With that being said, I would like to provide you with a Levine study that demonstrated modulin meets the criteria for PEN as part of the CDED. CDED combines modulin with a whole food diet designed to help patients gain control of their Crohn's disease, showing induced remission of 75% of pediatric patients at week 6 and 75.6% at weeks 12 of the CDED introduction therapy. It is also shown to be effective as EEN, but with higher patient acceptance rates of 97.5% of pediatric patients on the CDED in the clinical trial as compared to 73.6% on EEN. So I'm going to move to the next slide. So, doctor, there's 3 phases. The first phase is the induction phase. It's weeks 0 to 6 with 5 mandatory food portions and allowed foods such as mandatory fruits and soluble fibers, including chicken, fish, rice, eggs, potatoes, fruits, vegetables, and 50% of formula. The second stage is weeks 7 to 12, 25% formula, and mandatory fruits, soluble fibers, and more foods that they can choose from. Finally, the maintenance phase, 75% of total energy from expanded food list and 25% modulin. So I have one more slide I'd like to show you. So lastly, for you and your patients, there are many web resources at your fingertips, as you'll see here. Recipes, apps, tracking tools, on-demand education, but also to make sure you're aware, modulin is currently available to order on Amazon and the NestleNutritionStore.com website. So, doctor, we've reviewed the evidence of modulin. Next is to become an expert. You will be able to follow this website and complete 4 modules totaling 4 hours. Upon completion, you will receive an email including instructions for portal login. Doctor, how does this sound to you?
I feel like this will take too much time.
And Doctor, where I understand where you're coming from, please be reassured that the modules do not all have to be completed in one sitting, rather at your convenience and your pace. Becoming the expert will not only be rewarding for yourself, but also for your patients that you're seeing and who are suffering from Crohn's disease and are looking for new options. Wouldn't you agree?
Yes, that is true.
So, doctor, my ask of you today is, can you identify one patient that fits the criteria and can benefit from modulin?
Sarah?
Great. I will leave you a sample trial for her and follow up with you in 2 weeks. I look forward to hearing from you and your success with Sarah and Modulin. Thank you for your time and stay safe.